Doctors, have you ever had a patient that refused to get better? Nathan's mother burst into my office sobbing uncontrollably. He's getting worse again. You have to save my baby. Please, I can't lose him. I've been treating Nathan for 6 months now, and his case had become the most frustrating of my career. He would improve in the hospital, then mysteriously relapse every time he went home. We tested for everything from rare genetic disorders to environmental toxins, but found no clear cause for his recurring symptoms. Nathan presented with severe gastrointestinal distress, dehydration, and weakness. We'd get him stabilized with intravenous fluids and medications, then send him home with strict dietary guidelines. His mother, Elise, always followed our instructions perfectly, even keeping detailed food logs. Yet within days, he'd be back in the emergency room. I decided to admit Nathan for extended observation. We needed to monitor everything that went into his body and track his symptoms in real time. Elise was allowed to stay in his room, and she never left his side. She slept on the uncomfortable chair and only ate when nurses forced her to take breaks. During his hospital stay, Nathan thrived. His color returned, and he started playing with toys again. The nurses adored him because he was so polite despite feeling sick. After 2 weeks with no symptoms, I felt confident enough to discuss discharge. Elise's face went pale when I mentioned sending him home. "Are you absolutely sure he's ready?" she asked with trembling hands. "What if it happens again?" I assured her we'd continue monitoring him closely as an outpatient. We scheduled follow-up appointments and gave her my direct number for emergencies. She hugged Nathan so tight, he complained she was squishing him. Something about her desperation made me uneasy, but I attributed it to normal parental anxiety. 3 days later, Nathan was back. Elise carried him into the ER, barely conscious with severe vomiting and diarrhea. We ran the same battery of tests and again found nothing specific. His symptoms matched food poisoning, but Elise swore she'd only given him approved foods from our list. This pattern continued for months. Hospital stays where Nathan improved, followed by rapid decline at home. I consulted with specialists across the country who were equally baffled. We tested their home for mold, checked their water supply, even had Elise switch all their cookware in case of metal contamination. Elise started breaking down more frequently. She'd sob in the hallways, begging us not to give up on her son. She brought home cooked meals to show us exactly what Nathan was eating. Simple foods like chicken soup and rice that shouldn't cause such severe reactions. She was the picture of a devoted mother watching her child suffer. During Nathan's 5th admission, I decided to take a different approach. Instead of focusing on what might be wrong with Nathan, I started observing Elise more closely. She was always present, always helpful, always asking questions about his treatment. But there were small things that didn't add up. She seemed to know exactly when Nathan would get sick, often bringing him in before the worst symptoms started. She was reluctant to leave him alone with nurses despite exhaustion. Most tellingly, she always insisted on feeding him herself even when he was capable of eating independently. I quietly ordered some additional tests without telling Elise. Specifically, I requested toxicology screens for substances we wouldn't normally check. The results came back showing trace amounts of syrup of ipecac, an emetic that induces vomiting. It was an old remedy no longer recommended, but still available online. My blood ran cold as I realized what this meant. I called Child Protective Services and hospital security before confronting Elise. I needed to be absolutely certain before making such a serious accusation. We arranged for Nathan to receive all meals from hospital staff, only while documenting Elise's reaction. Elise became increasingly agitated when told she couldn't bring Nathan food from home. She argued it was the only thing he could keep down and accused us of not understanding his needs. When we held firm, she tried sneaking food in her purse. Security found homemade cookies that tested positive for ipecac. I had to sit down when the full weight hit me. Elise had been deliberately poisoning her son for months. Every hospital stay, every test, every tearful breakdown had been part of an elaborate deception. But I still didn't understand why a mother would do this to her child. Child Services interviewed Elise while Nathan remained under protective custody in the hospital. She initially denied everything, but eventually broke down when presented with evidence. Through her sobs, she told a story that made my stomach turn, even though part of me understood her twisted logic. Elise's husband, Wayne, was abusive. "You don't understand," she cried. "Wayne gets angry when Nathan makes noise or doesn't obey immediately. I've seen what he does to me. I couldn't let him hurt my baby anymore. That's why I did what cost me my medical license next." Full story on channel linked below.